Everybody, Dr. Rob Silverman here, Facebook Live, having a fabulous day on a Wednesday. Just saw a whole bunch of patients. A lot of people asking me about gut health. A lot of people not only asking me about gut health, asking me about gut health and the microbiome. So the microbiome is all that's going on in your body. And let's say it's your environment in your gut for today's discussion. So your microbiome is housing all the different, what we call living organisms, and we mostly speak to the idea of the different bacteria. As you've heard me say many times, we talk about the microbiome and the different bacteria, and there's a term that we like to use called dysbiosis. Dysbiosis, once again, is a leveling of good and bad bacteria. Now, the good and the bad bacteria should not be equal. To avoid dysbiosis, you need about 85% good bacteria. So there's really a high amount of good bacteria to have really good gut health. And that's why we always say you don't want to take a day off from eating. You don't want to take a day off from worrying about your guts. Do you have the guts to be healthy? What have you done for your guts lately? That kind of stuff. 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. We all know that. Your gut communicates with your brain. And that's a critical element. I was just on a webinar yesterday. We had a great panel with a whole bunch of guys from Marconia Medical. And we really were talking about brain health and really speaking to the idea of how the gut really affects brain and is the driver and the leader for health or, unfortunately, inflammation in the brain. So what I wanted to talk about is exercise and exercise impact on gut health. We always look to exercise because it's good for our health. It lowers our blood pressure. It keeps our body composition down. It makes us feel good and releases endorphins. But we overlook its positive effect on the microbiome. So I've got some numbers here that I wanted to share with everybody. Evidence suggests that exercise can modify the types of bacteria in our guts. When it talks about the types, it's the different type of bacteria. One, good versus bad bacteria. Also, the type of exercise will also depict the different species of bacteria, which will propagate what we're better at. So, for instance, if you're more of an endurance athlete, you're probably going to have bacteria that has a species and a strain that's going to promote that type of performance. Whereas if you converse, interestingly enough, if you like row, which is more of a power exercise, you'll probably see not just good bacteria, but bacteria that allow you to perform that. Or you may even realize that a lot of your genetics, we talk about genetics a lot. As you all know, I work with Toolbox Genomics, but we talk about genetics, about our bacteria, and what our bacteria in our gut allows us to express, almost to a genetic theme. And that's really interesting in that if I get Michael Jordan's microbiome, am I going to play basketball like Michael Jordan? If I get Tony Robbins' microbiome, am I going to have that kind of charisma in front of everybody? If I get Barishnikov's, am I going to move as fluently as he is, etc., etc.? However, the base idea is the evidence is robust that exercise will change the diversity in your microbiome and give you increased diversity, which is a critical element. The more diverse you are, you always want to be able to pick from the superpower of the garden in your microbiome. You don't want one type of bacteria, you want a multitude. And of course, you want to populate with a multitude of good quality health promoting bacteria. Exercise promotes the growth of bacteria that produces butyrate. So there's a probiotic bacteria, pro-life. So there's good and bad probiotics. There's a prebiotic. Prebiotic is what we feed the probiotic. We've talked about it. XOS is the best supplement. Good foods like Jerusalem artichoke, leeks, onions, and such. But the end result is what we call a postbiotic. What's left there, its essence. And something that I would refer to as a postbiotic would be short-chain fatty acids. Short-chain fatty acids, if you will, the gold medal winner, the real nugget is butyrate. And butyrate is a tremendous health-promoting short-chain fatty acids. It enriches the whole environment in the gut for overall health and can express different health promotions like decreasing in blood pressure, decreasing the gut-to-lung axis or aberrant communications between the gut and lung. The microbiome changes can be seen actually following just monix exercise regimes. 3 hours of exercise or less per week. So that's like 30 hours a day. 30 minutes a day. Steph was shaking her head. I'm sorry. I misspoke, 30 minutes a day. And when you think about it, I'm a big proponent of trying to get an hour of exercise in if you can. So you have a 24-hour day. If you can get in 4 to 6 weeks of 1 hour, you're certainly going to be over the 3 hours. But that half hour, 5 to 6 times a day is definitely a sweet spot, not only to promote overall health, but it's also promoting a good quality status of your bacteria in your microbiome. So what they did was they put some mice, believe it or not, on a voluntary wheel running, and they found that it attenuated a lot of health conditions. They also put people on mice on a forced treadmill running, which exacerbated intestinal inflammation and increased the outcomes in colitis. So what that meant was when you did very hard intense exercise for a long period of time, it actually was very deleterious to your gut lining. So it's this interesting curve, if you will. So if you exercise really softly and not that consistently, you really don't help your immune system. You don't help your microbiome. If you're more of a moderate exerciser with some intervals of high intense interval training like a Tabata, you're really going to have that diversity in the microbiome, and you're really going to optimize your immune system. Whereas if you drop, when you drop, you're actually working out too hard. Like triathletes may not have the best immune system. So when we look at the COVID-19 people, most of the athletes seem to be responding really well. They're not getting too sick. They're young, they're light, they're fit. Tennis player just got it. He's very light. He's 175 pounds at about 6'2". And they have interval of strenuous and steady state exercise. Athletes have very different microbiome profiles. I want to segue to that compared to sedentary people of the similar age and sex. Well, number one, athletes exercise. Number two, many athletes follow good nutritional programs. And number three, they've shown to have more diverse microfloras because of that exercise and the different kind of exercises and cross training. They've got that diversity. Remember that diversity in the microflora is their superpower. What higher abundance of different bacteria have really shown to have lower body mass, so much leaner body mass, and decrease inflammation. So one of the things I would say, other than eat a good diet, take a probiotic, is to exercise regularly, because it's really shown to help with the diversity and the quality within the diversity of your microbiome. So I wanted to give a quick example of, by modifying your gut microbiome, you're going to be able to absorb more nutrients. So you have your gut layers. You also have this thing called villi. They're like shaggy carpets. They grab nutrients. So if you populate your gut and your gut's in a more pristine condition, your microvilli are going to be in place. These finger-like projections are going to grab the nutrients from the food that you eat. Having said that, they're actually going to decrease the incidence of metabolic diseases, something like irritable bowel disease or irritable bowel syndrome, and immune diseases. So your gut health is really going to dictate the type of immunity that you have and the decrease in the kind of immune faltering diseases or conditions you may have. It's also going to decrease your incidence of autism. 90% of children now, in a study last year in May, were shown, if they had autism, to actually have leaky gut in the mom's microflora. Prior and during pregnancy also is implicated in that, because your gut and your brain communicate, and one of the best ways to get your nutrients to absorb and avoid a lot of these conditions is exercise. In addition, when they've tested through several studies, people who've taken IQ tests and leaky gut, and they found out those that had a better condition or a higher IQ also had a better gut health. So here we have some things that are really cascading into overall health performance. So when people come in, we always talk about the bullseye in archery. Well, the bullseye in people's health, the great starting point is their gut. Piggybacking on that, yesterday's really main conversation was gut, and more so really mental health and disease. So the gut plays a major role in that. Anxiety and such come from your gut. I got my gut feelings, I just didn't feel well. I got butterflies in my stomach, all that. All these old sayings really go back to the idea of the unleveling or the unsettling of the microflora or the microbiome, if you will. So essentially, the human diet, we want more fat. We want to watch our crappy carbohydrates, eat a better quality protein. We're always looking for the modification of the gut microbiota. So we've got a couple of call out, shout outs here. Hey, Jean, how are you? It's great to see you, hear from you. Let me give you a like. Hey, Wendy, how are you? Wendy's one of my colleagues. She works at Arconia Laser. She does a great job. So we're going to have her on. I've got a laser group, a mastermind laser group, and in that mastermind laser group, we're going to get Wendy on, and she's going to share some really cool ways from the marketing aspect on how to let people know all about the laser. So let me hit her with a like. As always, I try and excite everybody. I want to share something almost every day. Got a great question there by Jean. So, Jean, are there more? She's asked a really good question. Are there more villi in the small intestine, and are these the villi the ones that the glucose intolerance or Crohn's disease affect? Yes. So here you've got multiple layers. And you know what? I'm going to actually put up a picture and show your picture. And it is fine. It's effect, not effect. We knew what you meant. I'm going to show you a picture. I'm going to give Stephanie a picture, and that picture will attach as a link. It'll be a little PowerPoint so you can see the anatomy. But essentially, you have these layers and you have this mucosal lining. The mucosal lining is a critical element because it aids in sliding and gliding, and that mucosal lining in your gut is critical for overall gut health. It's overall good gut health, good health in general. Above that are these villi. They're shaggy carpets, and that's what it means in Latin. So that's what gets damaged and taken away. So she's speaking to the idea of glucose intolerance. Glucose will damage the microvilli because it's glue. It'll stick there, and through inflammation break it down. And coupled gluten with something called Roundup, which has glyphosate. Glyphosate now is a weight on the gluten. So you got glue and a weight on the gluten, and glyphosate is very damaging to villi, and ultimately without the villi, you're going to expose the mucous membrane and may expose the layers, and then you're going to get your leaky gut. And Crohn's disease is an issue. Crohn's disease is all through the intestinal tract and lining, and there's glucose, there's celiac disease, glucose intolerance. It's a great question. So let me see if you have any other questions, if I missed anybody. Hey, Shanae, how are you? You were working out hard. I know you're doing a great job getting back into shape, and I know you're coaching people now, and we wish you the best with all of that. So once again, if anybody has any shout outs, any requests for topics, we're very happy to speak to what you want. I'll definitely have Steffi post that PowerPoint. And please like, comment, share this. We didn't get a lot of shares yesterday. We're looking for some more shares. We really think this information is valuable and it's worth sharing. So hope to hear from you all soon. Dr. Rob, always yours in health.